Rheumatoid arthritis is the most common type of chronic inflammatory rheumatism. It is described as chronic because it develops and persists over a long period, and inflammatory because it triggers an immune response directed against the joints. The condition mainly affects women between the ages of 40 and 50, especially during the perimenopausal period. It is a progressive and destructive systemic disease of unknown or idiopathic cause, meaning it can affect multiple parts of the body beyond the joints. Consequently, its effects are not limited to the joints alone, and its complications are generally divided into two main categories. On one hand, it deeply affects the joints. It can lead to visible deformities and irreversible destruction of joint structures. This can severely impair physical function and therefore affect the functional prognosis. On the other hand, it can also cause extra-articular involvement, meaning damage to other organs such as the lungs, heart, or eyes. These complications can sometimes be life-threatening, thus affecting the vital prognosis. There are two main clinical presentations depending on the stage of the disease. The first is early-stage rheumatoid arthritis. At this stage, diagnosis is often difficult because the signs are mild or non-specific. However, if the disease is detected early, treatments are generally very effective, and it is possible to slow down or even stop its progression. The second presentation is established rheumatoid arthritis, where the clinical signs are obvious and the diagnosis is easy to make. However, at this advanced stage, treatments are much less effective as the lesions are already established, making the after effects often irreversible. Rheumatoid arthritis is a multifactorial disease, meaning that it results from the interaction of several causes. Among these, there is a genetic predisposition, particularly in individuals carrying the HLA-DR1 and DR4 antigens. To this predisposition are added environmental factors such as smoking, certain bacteria, or viruses that may play a triggering role. In addition, hormonal factors also seem to contribute, since the disease is more common in women, especially around the perimenopausal period. It is a connective tissue disease related to a dysfunction of the immune system, more precisely to an abnormality of cellular immunity, where the body's defense cells turn against its own tissues. The central element of this pathology is inflammatory synovitis, which is an inflammation of the synovial membrane lining the inside of the joints. Although the exact mechanism that triggers the disease is not yet fully understood, it is known to progress gradually through several phases. The initial phase is marked by a non-specific inflammatory reaction, meaning that the body reacts without targeting a specific agent. During this phase, macrophages produce pro-inflammatory cytokines such as interleukin-1, tumor necrosis factor alpha, and interleukin-6, which maintain and amplify the inflammation. Next comes the recruitment and neoangiogenesis phase, during which macrophages attract other immune cells such as T lymphocytes and neutrophils, PNN. This cellular recruitment contributes to an abnormal proliferation of the synovial membrane called planus formation, leading to chronic synovitis. Finally, the disease enters a repair phase, during which the body tries to defend itself by producing scar tissue, leading to fibrosis. However, this repair attempt is insufficient to compensate for the damage caused. It often occurs alongside joint destruction, unfortunately contributing to permanent joint deformities.